Have you had the experience that you go to therapy and you start wondering, what is the point of this? Why doesn't your therapist tell you exactly which decision to make, what to think, what to feel, and what to do? That ChatGPT gives better answers than your therapist. And that session after session, most of what you do is just talk. That's it. I can bet that you're not the only one who feels this disappointment. If you are someone who is looking to start therapy or someone who is already in one, in this video, I will clarify for you exactly what happens in these sessions and what will change you. Hi, I'm George Felix, a clinical psychologist and a practicing therapist, and I make videos in which I simplify such complex psychological topics for you. Most people enter therapy with the expectation that they will receive expert guidance. Movies, shows have also portrayed therapists either as downright rude or as these wise gurus who are going to frame beautifully worded sentences for you, and you will receive them and you'll have a breakthrough, and the next day you're this different person who's somehow got this different outlook on life. I really wish that it worked that way. But at the same time, I don't blame you. I can totally understand how frustrating it must be to go session after session and pay for them and not get anything solid out of it. After all, that's how most professional relationships are supposed to be like. You go to a doctor, you tell your problems, you get medications, and then you get all right. You call an electrician, they fix your wiring, and well, not your wiring, but you get the point. You approach an expert and you get solutions for that. So, then what is happening in therapy? What is going on that you should consider it? To make this point, I want to introduce a quote by a famous therapist, Irvin Yalom. He says, "It is the relationship that heals. The relationship is the therapy." Complicated? Let's simplify that for a little bit. When you come for therapy, you don't just bring your problems, you bring yourself, you bring your patterns. Patterns you have learned across your years. And these patterns, they tell you how to love, how to care, how to attach, and also how to fight and protect and avoid. They also tell you how to work, how to focus, how to discipline yourself, and how to regulate your feelings. These patterns have formed as interactions with your important past relationships while you were growing up. But how is that relevant to the therapy relationship? The therapy relationship is a special kind of relationship because, unlike other relationships, this relationship is mostly one sided, where you are hyper visible for the therapist, but your therapist is relatively unknown to you. This creates a sense of difference, a distance. And due to this imbalance, as humans, we have a tendency to know the person, right? We're always forming impressions of of people we meet. And so we tend to project our own histories, our own patterns, our own understandings of ourselves and the world onto this person who's sitting in front of us. And this is a very normal need. We just want to know the person who's sitting in front of us. And we do this with almost all our important relationships. We do this with teachers, relatives, politicians, actors, people sitting in the metro. We're constantly getting data and we're filtering it out through what we already know about ourselves and the world and people. And we make judgments, impressions. Can we trust this person? Is this person intimidating, friendly? Are they going to judge us? All of those impressions. And they are automatic and unconscious. It's not that you're sitting and analyzing very actively. So, let's say you have come to therapy to resolve procrastination, for example. So, we work through that. But across sessions, we start noticing that you have started to procrastinate on the therapy homework as well. Now, that's curious. So, we explore that. and we identify certain triggers in your life that set off the procrastination. For example, a boss has told you to finish something before the deadline. When we explore that even more deeply, we find out that this pattern, this interaction, has developed in relationship with, let's say, a father who was very demanding and not satisfied enough, or a teacher who was very cruel and strict and perfectionistic. All right, a past pattern seems to be triggering something similar here in your current life. Now, this is where it gets interesting. You don't know your therapist that well, but even in this relationship, you are unconsciously relating to the therapist as if they have demanded or assigned or pressured this homework out of you. This is why the therapy relationship becomes a data point, a living laboratory, if you want to call it that, where you get to activate your patterns with someone you don't know that much. An expert therapist picks up on these and helps you resolve them. A skilled therapist is hyper vigilant about these patterns right from first contact. They are tracking these patterns and they make decisions in their mind what to do about it, whether to let you know or it would be harmful to let you know. All of this process goes on as part of the expertise of the therapist through the data gathered in the relationship. That is why this kind of work is heavy, tedious, complicated, but at the same time, it changes you at a fundamental level. It changes who you are as a person. And that change is long lasting. You may not even realize that you're changing. It is that subtle. All right, so what to do with this information? Where do we go from here? Does this mean that you shouldn't expect anything concrete, actionable out of your therapist? Well, absolutely not. In fact, your needs, goals, and your wishes are an important part of your therapy journey. I want to make this point using another analogy, and maybe then it may make a little bit more sense. The breakthroughs, the insights, the techniques, the goals, the worksheets, and the charts, and all of that are like seeds. The relationship is the soil. You can have all the seeds in the world. You can get them from Google and ChatGPT also. But if you don't have the soil, they aren't getting planted. Just a few key points to remember when you start. Ensure that your therapist is curious about you, cares about your concerns, has some experience working with concerns similar to yours. At the same time, you are able to somewhat speak with them freely, with even if you're feeling nervous. Give a few therapists a try, and then stick with one with whom you feel these points meeting the best, and then stick to this person for the long term. Then if you find yourself having feelings, issues with the therapist, then they are part of your patterns getting activated and they're part of your therapy work and your change process. If you found this video meaningful, please consider subscribing and hit the bell icon so that you don't miss out on the next one. Thank you. Please take good care of yourself, and I'll see you in the next one.